I am going to turn it over to the panelists. I just ask if you, whichever way you want to start, if you want to start with Leo or Ms. Doris or whoever, if you could just introduce yourselves in terms of your name, the organization that you're with, and then if you could just briefly describe a specific research project you've been involved in that has stood out to you in whatever capacity, whatever the way you feel like you want to have memories of that particular project. So I will let you all get started.
You said we had how long? I just need to know. Okay. I don't know how many minutes. I have 45 minutes. Okay, 45 minutes for everyone. It's good to see everybody here. I always, as she knows, I always acknowledge God and his glory. And I like to acknowledge that this event is being held on traditional lands of the Native people. And I would also like to acknowledge the people of African descent who involuntarily cultivated this land throughout the United States. And I pay my respect to both Native and African elders, both past and present, as well as our Hispanic brothers and sisters. Why do I do that? Has nothing to do with research, but it's a matter of respect. Who am I? My name is Doris Lassiter, and I have a firm called Doris Lassiter Consulting with a project called Nebraska Center for Healthy Families. The project that stands out to me the most is the project that really confirmed a little bit of research that had been done earlier with faith-based organizations in Alabama. And these were churches who had high-risk populations, as most churches do, because we love to celebrate and we love to eat. And we decided we would focus in on the stroke belt of the South, which was known by NIH and the Office of Minority Health. And after a bit of pre-research, we put a proposal together and said, let's explore this further. And so we worked with 12 churches. From that research, I brought it back, and we were stationed and based out of Omaha administratively because I was here. That's the only reason why. It was a national, it's part of the National Baptist Convention USA, about 72,000 members. It was a pilot project. And so the work was published. We showed some improvement on obesity reduction and participation and training of establishing faith-based health ambassadors. And that was over about 15 years ago. And so that work has continued with various institutions, including Creighton and, of course, UNMC. And that led to what I'm discussing today, and that is with UNMC and with the center here. Well, it wasn't here at the time, but it's here now. We looked at some other programming with faith-based communities and working with churches. How could we expand that even further? What in the community, what do community people want? Instead of having us come in at the back end, it was basically community participatory research. And I'm sure others will talk about this. Some of you already know what that is. But community participatory research was very important in my participation with UNMC. In fact, I wanted to make sure that there would be some minority researchers involved with the project. That's important for me. We're going to talk a lot about a lot of things, but there was nothing on the agenda to talk about the importance of minority researchers involved in community research. And we'll get to that. See a lot of familiar faces. You all know I've been involved in infant mortality, minority health for a number of years. So my positional statement is always, I don't get involved in healthcare programs and research unless it's going to be about racial and ethnic health disparities. Even today, at the end of this, we need to be able to say and take back, here's how I can use this to address this issue of racial and ethnic health disparities regarding chronic disease, diabetes, all of the chronic diseases that we know about. But the project that I was involved in with UNMC meant it took a little different toll because they were, quite frankly, used to designing surveys to take back out to the community without any input from folks in the community. That's true. So yes, I agreed, but I wanted to be a part of designing, you know, the survey. And because some of the questions weren't quite right, let me put it that way. So we had to be very sensitive to that. And then the method of how we would collect the data was important, which meant if you're going to go to the church, you have to go to the people when they're where? At the church, which is what day? Sundays, right? Now, a lot of people would say, yeah, you know, but can we do this on a Saturday? Invite? No, no, no. Let's just take it to the people where they are. I've got a witness right here. Portia Cabot was one of the, Reverend Portia Cabot was one of the churches involved. Had, I think there were about 15 churches. So everybody had to go, not after service, but my request was have your researchers attend service so they can understand and really understand the culture. And every church has a different culture. So that helped. People are a little shaken back. You know, you can sit in the back if you want to, but it would be helpful if you would, you know, kind of sit at the pew, on the pew. And so they did. It took an extra time. Also, too, we made sure that the participants were paid a stipend. Now, listen, this was not a 2-page document. It was about 25 questions. This is after service, right? Between service and dinner. From many of the Baptist churches and Methodist churches, that's a long time, okay? And with Bobby Waters, Reverend Bobby Waters as well, his church. And so they did. The survey was very extensive, but it gave us the information that we were seeking from the people we wanted to serve, that UNMC said they wanted to serve, that would help with other grants in applying for other grants, whether it's with NIH or regular community grants, not necessarily direct research grants, but community grants. And so what that taught me was we've really got to get more minority researchers involved. We also need to make sure that when we ask for research that people understand what we're asking for and sharing that information. It was important after the information came back to take it back to the churches and say, this is what your respective churches said that they wanted to address in their churches. They wanted to have, whether it was diabetes training or on-site support groups. There were many, many issues, some quite surprising to me, that they wanted to address the issues, including mental health in the church. It was a little different than what I expected, but nevertheless, it led to some other grants being applied for. Some we got, some we didn't get. But the point of the matter is that we heard from the people themselves. The information was shared back with them, which was important. This wasn't the helicopter research where people come in from the different institutions and you never hear about what's going on. It was important for them to go back and so they could share within their respective communities. So I'm going to leave with that because I know others need to.
Hi, everybody. I'm Fabiana Silva. I am assistant professor at the College of Public Health, and I do community engagement research. And I think what Ms. Doris just said, I'm one of those researchers. I'm a minority, and I'm a minority researcher, and not a minority just because who I am and how I look like, but also the way that we think as well. Because we understand and we know the benefits, and that's why I was surprised to be in this panel, because I was like, it's always the same things. The researcher talk about What's the benefits that they bring to the community? And actually, I think that we benefit much more from the community partnerships than the communities benefit from us. So, and usually we are invited to be the voice of the community. And it's like, why not just invite the community to talk? They can say what's the benefits and the malefits as well, because sometimes, so Ms. Doris, I was introducing myself and I was thinking like, I'm a researcher, I'm a non-helicopter researcher, because the current project that we are having right now, I think that's the major example. So I'm here to talk about like my perspective as a researcher, and I don't want to talk about the benefits of the researcher from the community, because that would took me like 4 hours, 2 days to talk how much we benefit to have those community partnerships. But I'm going to focus just to say a little bit about the mutual benefits, because that I can understand, like some examples where we benefit that we saw that maybe the community could have benefit of that as well. So my example is currently we are doing research with rural communities. So we are culturally adapting technology-based, that's AI-based, childhood obesity intervention to help to address childhood obesity with rural Hispanic families. So and how that came about was not coming here with a survey. That's a combination of 6 years of partnership. So we make those contacts. We got to know them, to learn, and surprise enough, that's why I say this project it's combination and is one example, because when we first come to those communities, my first thought was like, we're gonna do a diabetes project or maybe adulthood obesity project. And the community is like, you know, we really needed to address childhood obesity first. So they don't become those adults obese and they don't become the diabetic people. So I was like, wow, so let's talk a little bit. Let's change our mindset and our project as we go. And when we start thinking about the age, so it was like, okay, we have this evidence-based intervention that work from children to 6 to 10 years old, and that's what we're going to be doing. And there's like, you know what, we have that those children that usually they 8 to 12 years old, they don't have any project, because you researchers and all the programs are usually developed for 0 to 5 and sometimes 5 to 8, but we have that gap. We don't have any program to offer them. It's like, great, let's change our eligibility criteria. Let's see what we can do with that. The second step as well was related to how we do our research, our science piece. So usually, you know, randomized clinical trial, RCTs that everybody talk about, we need to have a control group. So we talk a lot, and it's like, you know, you wanted to come to community and say like, okay, half of you are gonna get something and half of you are not getting nothing. That doesn't work for us. So that doesn't work at all. So what you can bring for your science that can help us to have a different design. And so we talk a lot with our community partners, and we have 4 different areas that cover 24 counties across, from Scottsbluffs to Norfolk. So it's a lot of conversation, a lot of different profiles. And you're like, okay, so we compromise and got to maybe let's do the wait list. So people that's in control group, now they can go to the wait list. So after 6 months, they can have the program. So they just need to wait. It's like, okay, I can sell that to my community. So that's some examples how we do. And as well, when you're planning, so these projects come about all that conversation, all that willingness to compromise from us researcher, and as well listening to the community, because what we wanted to do, it's not research in the community, but what we wanted to do, it's develop programs specific to our lab, because we are different. As I say, we are minority, I know, but what we wanted to do is listen to communities and develop programs and intervention that is not just for publishing, it's not just to get the next NIH grant, but it's to develop a program that would work for them. So for that, we need to work with them and understand what type of resources we have. Because it's easy when we have the NIH grant to hire all those research assistants to come and do the work, and we have all the resources and the materials. And when we leave, they don't have those resources. So let's start thinking when we develop those programs and interventions. So what type of resource you have? So how we can do that with using the community health workers. But for that, we need to talk with them. It's like, do you have the time? What are the things that you need to do that with your community? And so that's how it came about, and with the health departments as well. So how you can make sure that right now when you plan and develop that fit your resources, that fit your needs. So those are just some examples, and I could be speaking a lot, but I don't want to steal the time of people that actually need to have the voice over here and talk. I'm curious to know what type of benefits that they see to work with us. And I hope that we can bring at least a small percent of benefits compared to the large benefit that us as researchers get to by working with communities. So if you have any question, I'm going to be here and can give more details about our partnerships.
Excuse me. So I'm a member of the Sicangu Lakota people. I'm the cultural specialist for Omaha Public Schools. And so within the school district of the 53,000 students in OPS specifically, we have been searching for our lost babies. And we found 800 of them so far. And thankfully, because of the government and what they've done to the indigenous people is, I don't know if you're aware of the blood quadrants, the blood quantum that exists, in which we have to prove who we are still today. And so I'm an enrolled member of the Sicangu Lakota. I correct the wrongs in the curriculums and the lesson plans within our mainstream education system. The first thing I say when I go into our schools is, American history is not our history. Nobody speaks of the atrocities committed against our people. There are the reasons why of the health disparities, the food deserts that exist on the worst lands that are created in the United States. This is where our POW, our reservations still exist. A lot of our people are still reliant, dependent on the annuities gifted to our people because of treaty rights. And so I focus on the 6,000 indigenous people within Omaha itself. We have found over 800 once again, because of our 506 forms that exist within the school district. And so to be a part of our program within the NICE program, the Native Indigenous Center of Education within the OPS school system, there is requirements to be a part of our program. And so what we focused on was, once again, cancer. And so for all of your researchers, the research, the data doesn't really exist on our reservations because of fear, because of mistrust, because of, once again, the atrocities committed against our people. And so we are a very quiet people. We don't reach out. And so we are the survivors of the American Holocaust that nobody speaks of. What happened to the millions of indigenous people here? So today there's only 3.5 million enrolled members in the United States. But in 1890, there was only 200,000 of us left. And so we're trying to build our population. And so I founded a nonprofit organization, Bluebird Cultural Initiative. And so this is my nonprofit because of the restrictions placed upon me within the Omaha Public School District. I wanted to reach out because I'm not used to boundaries. My territory exists on Turtle Island, known as North America. And I'm glad you acknowledge the lands of the Umaha people. The state is the western boundaries of the Umaha. That is the flat water. Echeletni Badaska is how you say it correctly. Because when the Hishma'ite came down that river, they were the fur traders, the French. When they first came down, They were amongst our Umaha relatives, and they asked them, "What do you call this place?" It's like Ni Badaska, and this is how you get Nebraska. And so I teach through our language. I incorporate the culture. And so once again, what has happened to our people? The kids that I work with, they see firsthand of the food deserts that still exist in Omaha itself. And so understanding that, I partnered up with the NICE program, UNMC, and this is where I met Aislinn and Regina. And so the director of the NICE program is Tracy Bradley today. And so understanding that, we focused on the art. And so I am a traditional artist. And that means that when I create my art, I find all the materials that I need outside. From the skin and the bones, I make my own paints, I make my own hide glue. I still butcher my own buffaloes, elk, and deer, because that hide is my canvas. And so with my skill set, partnering up with the research, with the stats that UNMC and Aislinn and Regina provide to me, we have started this journey of creating art, of creating awareness to that next generation. And how can we change the future? Because it is the food, it is in the air, it's within the earth. And we have to be mindful of our own self. And so I incorporate that cultural component, specifically in different languages. Echelechaku sichake is how we identify cancer. And so I speak 4 different native languages. I incorporate these into our teachings. And so that chaku is the disease within the bone. That's what cancer is to us. And this was a word that was created because we never had cancer. It was created. And so today we are dealing with all of the atrocities once again. And so I'm trying to help that next generation understand, how can we change? And it's all about prevention. It's about bringing an awareness. And so I am an environmental activist because I'm standing up for our land and our water. And so this is what and how I've been identified and labeled as today. And I was like, I just want to have a healthy life. And that's all that is. And so through the arts, we were able to incorporate the historical context, expand on our communication skills, ideas of self-expression within 1,000 different nations. Because we are not the same. We are 1,000 different nations within and living on this land. And so I sit and I visit with the old people. We call them our elders. And what do they have to share? One of my takojas, one of my grandsons, actually created a song about cancer that we're going to take all over South Dakota to bring an awareness once again. And how can we prevent that next generation from coming down with this disease because of intake, because of the air and the water. And so understanding that it is through this art-based partnership that we are trying to help the next generation. So I'm really happy to be invited to be a part of this panel. And so I travel the country as a traditional artist, as an indigenous being. And so if anybody needs any help, let me know. Thank you.
No, it's great to be on this panel with all the diversity. Thank you. And thank you to UNMC. I'm Leo Lewis, human. My primary role within the organization that I'm with, which is the Malcolm X Memorial Foundation, is I serve as the board president, but in the community, I serve as a community organizer. My work began as community organizing, has always been community organizing. So any organization that I'm with or working with, that is the primary function that I serve when I'm with those organizations. The work that we've done in community-based participatory research with the Malcolm X Memorial Foundation started with the community. It didn't start with the organization. We didn't have an idea and decide we were going to go out in the community and do something. It was that we often run across people during our town hall meetings, community forums, or just conversation or outreach. And those conversations and outreach turn into the work that we actually do. So our first project with UNMC through community-based participatory research was to discuss gentrification in North Omaha specifically. That work came from many town hall meetings and community forums where individuals could not remember locations that they had gone to as children because they do not exist anymore. So literally their memories were being erased and are being erased currently. So there was an exhibit that was held at the Union for Contemporary Arts about undesigning the red line, which you may be familiar with. And that conversation was taking place at a very large level within the Black community specifically. Now, in that conversation, there's multiple other layers that go along with it: violence, education, disparities, health, etc. And at the Malcolm X Memorial Foundation, we were asking the question of what is the other community thinking about this process as they participate in this process. So working with UNMC, we flipped the research on its head, and no longer was it going to be that community residents were going to be asked a bunch of questions about how they feel about the curbs and how they feel about the streets and the potholes and the lights. The community was actually asking the question, what are these developers thinking? Why are they not considering X, Y, and Z in our community? And so instead of us going to them and asking them these questions, our research project became one in which the community itself, when that question was created, would get the answers that they had to the questions that they actually had. And so the actual community in our research project became the developers. It became the individuals that actually make the decisions, because that's the community that needs to be investigated and needs to consider for itself, what is our values? How do we see the communities that we impact with our development projects? And that was the question that we asked from our organization. That was our first CBPR project. And the results of that project were very interesting, which we'll get into later. Our follow-up project was one in which that also started from the grassroots. I personally had an experience where my nephew was being suspended from school at the age of 7 years old. He was play fighting with another boy, and he was suspended. When we had the conversation about the suspension, his play fighting was described as assault, battery, and it was given more criminal connotation. Did a little bit of research and found out that this is exactly how the school to prison pipeline works. So the Malcolm X Memorial Foundation held a series of town hall meetings to address this issue. And what we found was that hundreds of parents had been impacted by this. We did a little further, just independent research as a community, and went to our school board members, and the school board gave us data. And when the school board gave us the data in 2018, at least it was 56,000 students enrolled in OPS. Out of those 56,000, Black children account for 14% of the general population. Out of the 14% of the general population, Black children accounted for 56% of all suspensions. The highest numbers of suspensions were between pre-K and second grade. So these were formidable years that we were referring to. So when we look at the school to prison pipeline, this is exactly how it works. Doing further research, we found out in the mid-1990s, when schools were having a lot of issues with drugs and gangs, that many school districts adopted a process called PBIS. And it was a measurement of how school climate was. And then it went from school climate to what were some factors in the classroom, and then the individual child. And these were called tiers during this process. But we found out that the school system in 2018 had duplicated that process all over again, and they called it MTSSB, which is multi-tier systems of support. And the school system still uses that today as a way to measure school climate and child behavior. So these all of this information came from just a number of town hall meetings and community forums and us having conversations. We were able to work with the university with another CBPR project, and again, start to ask the question, how can we prevent these pre-K to second grade suspensions? During our process, of beginning to engage in the research and having conversation with community members, we actually formulated our research question, which again is very foundational, having a good research question. It wasn't that they were coming in to tell us what to do. They were actually listening to us and giving us an opportunity, which really built a lot of trust between the community and the university, which has not existed at this level that is starting to exist now. So we're really thankful for that. And out of the question came, again, another opportunity for us to better understand the systems that we're participating in rather than the system trying to understand us better. Because the system has done a number of research projects on us and knows us probably better than we know ourselves. However, we don't know much about the system. So the research question that we followed up with was, how does the pre-K to second grade suspension impact individuals and institutions who serve the parents and children of the suspended? With that information, our community will be better equipped to approach teachers, faculty members, administrators, etc., when there's time for a conversation, because we would actually know our impact on how we respond. Did us cussing out the teacher cause her to go outside, smoke more cigarettes, increasing the death rate of teachers? Did us saying, you know what, I'm pulling my kid out of this school impact the financial stability of that school and further damage other students? We don't know, but we would know when this research project was completed. So working with the university and the community directly and merging that gap between the institution and the grassroots people on the ground who experience this project has been very beneficial to our organization, in our community, in our research. And I am happy to announce here and publicly that this year, the Malcolm X Memorial Foundation, in conjunction with Senator Terrell McKinney, was able to pass LB 632, which is to ban pre-K to second grade suspension statewide in the state of Nebraska. And this has been done through grassroots activism, community organizing, and community-based participatory research. And that's the results of the type of work that we've been doing.
Thank you all for sharing a little bit about yourselves. It's always so, I know each of you, so it's always so great to hear and learn more every time I talk to you, each of you. Okay, so remember that the panel is really focused on just thinking about what are the benefits of research for community partners. So each of them shared a little bit about their experiences in that. So I want to open up the floor to questions. We have about 15 minutes to ask questions, so I will allow you all to start. Don't be shy. And make sure you use your microphone so that people online can hear you. Go ahead, Michael.
Hi, good morning, everyone. My name is Michael Griffin. Nice to meet you. So my biggest question is, as a researcher and an academic and all the titles, I sometimes forget the why behind the research, behind, why we want to do this. And so I think the community, not only do we need to share information, but really to really be transparent with the why and what to do with it, And so what are some steps that we can really take to move past sharing information and more having an understanding on the why, so that can kind of materialize into a behavioral change, which is what we're really interested in.
And you are asking it from your perspective. One of the things I've learned is that to understand the why of the researcher, what is his or her personal reasoning for wanting to do the work that they're doing with certain communities. Is it so they can be published? Is it so they can get tenure? What is your why in that? Is it simply to do your job? Okay, because we do know that when you get published, that means something, but it also should mean something to the community. And you should acknowledge the community when you do get published in your publications and the people who are working with you. That means a lot to the community, not just one individual, myself or any of us, but the community was a part of it. So your question, I'm going to reverse it back. Why are you in research? if not to help?
I personally am involved in research because I have seen what happens when folks don't have access, both, you know, to resources, but also internalizing unhealthy behaviors. And so, how can we shift behaviors so that we can act in our best interests?
You know, what's interesting doing grassroots organizing is that when you show up to a place, especially institutions that have systems that have been in place for a very long time and they have a way of functioning, when the people show up, the people do not have the background, the information, the data to speak the language of the institution. And oftentimes when we're sitting in the room, we have the conversation, we're talking about lived experience coming from our cultural background. So it comes out in the language we speak, the behaviors that we have, and the tone that we want to deliver it in. And oftentimes that does not compute or translate to the individual sitting behind the desk or behind the podium, listening or receiving this information, and they don't know how to translate it themselves. So the research in between is like the glue that brings it all together. Nobody, what do they say? Don't argue with the data. You can't argue with the data. The data is there. And so then it was when OPS gave us, when the school board member gave us the data at Malcolm X and said, this has been a problem for years, Leo. You should ask the community what they think about this. That gave us the opportunity to really push our case. Because as I'm out handing out flyers hand to hand in real time, talking to real people, and they're thanking me for doing this organizing work. They're saying, thank you. This really needs to be addressed. My kid got suspended yesterday. Talk to the daycare owners and they say, we got 4 kids in the back right now that just got suspended. And I don't know what to do with them because we didn't have enough food for them because we didn't prepare the day for 4 extra youth to come along. We have to have an extra driver go to this school to pick up a kid midday because mom's at work. These are the things that when you're telling a system, the system doesn't care about that. The system says our job was to pick them up on a school bus, put them in the classroom, and get them back home on a school bus. The system didn't prepare for what impact it has on the daycare, what impact it has on the auntie or the uncle or the cousin who has to watch this kid. The system didn't prepare for any of those things. But the juvenile probation system prepared for it. It said, okay, in 10 more years, we need to make sure we have a juvenile facility because we see that the suspensions are increasing. We need to make sure that we're prepared for that group when they come. And then the prison industrial complex gets on board and says, oh, you're building a youth facility. We need to make sure we build another prison for the next 5 years because we're going to need one in rural Nebraska. It's going to create more jobs and we're going to have opportunities. And you connect it all the way down to simply a child who just isn't getting enough sleep. You can connect it all the way down to that. And if we can connect those dots by having the conversation in real time, and then that data get documented and put into a format in which the institutions understand how it impacts their bottom line, positive or negative, we can negotiate what the outcomes are going to be. And we all can work on the change behavior.
Okay, I have a couple of things. And to you, Mike, I would look at your reason for being in research is that you look like who you're getting ready to research. That's been a big issue in the Black community. It's almost like politicians. You never see the politicians until they get ready to run. Okay, so the same thing, someone gets a big grant, and I mean thousands and sometimes millions of dollars. And so they want to research the Black folks, and the issue is, part of the issue is we never get information back as to what became of the research. And you offer out $10, $15, and you have thousands of dollars that you're working with. And so if I'm part of your research and I have to use my gas to get to where, I mean, there's a lot more that should go in on that other end, built in, that can come back to me as the person that you're researching. And so I have a big issue with that. Having being able to go into the med center and kind of see the inner workings, it's it's big dollar. And I sometimes think that the thought is misserved. Oftentimes you go out 42nd Street, you always see huge something building this building for this and building this building for that. And to me, it just seems that more money should go into your research project for the people that you're researching. And so to those of you that are of color and have the opportunity to be able to do these research, I'm gonna open up my door if I see someone standing there that looks like me. And so there's a lot of barriers I feel that need to be fixed, crossed, however you want to put it. So that it's not just you researching me. So I guess I don't have anything else to say, but that's.
You know, we're partnering up with UNMC. You know, the research that we focused on was Aislinn and I, we took our kids to the rivers to test the water. We tested the soil, we tested the air with our radon kits. And so we were like these little researchers, you know, and opening the minds to our that next generation once again to the mainstream, to that science world that has never been offered to them. And so when you think about the indigenous people, once again, we make up less than 1% of the population in the nation. The same with the population within the school district. So we are, underrepresented. And so for me, and you're exactly right, because when I go into that classroom as a male, as an indigenous person, Echa Lakota Wogalake, coming in as a Lakota, it opens their minds of the potentials that exist. And so, partnering once again with Regina and Aislinn, we're opening those doors that has never existed because nobody's ever thought about this. And so, but bringing an awareness of the disease and what exists because of our lifestyles. They get to watch their old people, the caretakers, because we know how it is. Most of our kids, they don't have parents. And so they have guardians. If they're lucky, they have a grandma. And so this is the reality that we face every day. And so that's why I came in kind of late, because I was working with 26 kids and I was just trying to hustle them out. But I can't thank you enough once again for inviting me, and Aislinn for all the work, and her commitment to our kids and to our indigenous community here. And so thank you once again.
Yeah, I'm just gonna address one thing because I talk with Michael a lot about like why we are here, what we're doing, what we're doing, and you're right. It's because work with communities and coming from those communities, we don't see people looking like us. We don't see people thinking about us. So we see a lot of those, specifically being a research and academic, was because everything, all the evidence base, all the data, all the things, they are not, those questions was not asked by us. So I think that's the why. Is like we need to ask those questions and we need to say what questions that we wanted to be answered. And I hope that's not recorded. It's like I'm gonna deny. but when I talk with my community partners relate to that, it's like we have all that money to do research, to answer questions scientifically. So let's take advantage of that. What do you need? And that's how our project came about. Yes. What? And that's why I agree to take advantage of that. Like, if you have $1 million to research, we need to answer what the community wanted to answer. So, for example, our project was like, what do you need? Like, we wanted to develop that childhood obesity program. And we need that in Spanish because that's what we don't have. So if you wanted to come and build a program and use your technology and use your expertise, this is what we need because we don't have right now. We don't have the resource to build that. And that's our current need right now. So let's use that as the base. And the second thing, when you talk about CBPR, community engaged research, it's always good to develop the idea, develop the proposal, but sometimes they don't have the seat in deciding the budget. So that's the things like, what would be a fair gift card? What would be that money? So instead of hire staff, why we don't pay for the community health workers, the community liaisons from the community? And that's what we did in our project. Was like, it's hard to sell for those institutions to say like, why you giving that money to the communities? Like, we are not giving them, we are paying them for their expertise. We are paying them for the time, for the service that they're gonna bring. So you're paying us for our knowledge and expertise, and you don't want us to pay them for the knowledge and expertise. So all that discussion is not easy. Sometimes it's not fair because we have some restrictions and what we can spend or not spend, but that fight needs to happen and that conversation needs to happen. And that's what we try to do. So for example, our project helped during the COVID. I was seeing that presentation early. With the COVID, we have like X amount of hours for the community health workers and community liaison for our project. So when IRB suspend research during the COVID, because we cannot do research in the communities, right? So they wanted to suspend the payments because we are not using that time. It's like, no, they are helping, so we can have that community after that to survive. So we continue paying them, even that they are not work for our strict research, but sustain that community health work. We cut that incentive. The health department is going to lose that incentive to pay them. So use our time. So now we're just sitting over there and waiting for that reopen, but use that time to help the community. And you're going to be back when you're going to be back. So it's those type of conversation. What type of resource that you need? Do you need a printer? Do you need, what do you need? It's not just our resource, but also what the community. And that's why I told my community, that's why I was asking to not record in that sense, because like, why? Use me. Let's figure out how we can use the system to benefit us. And that's why that I go to this community. That's why I should partner with you, because I'm here with you. Let's figure out the system and let's figure out how we can use the system for our benefits. Not going to be easy. We have fights every day with the IRB so they can understand why we don't need 6-7 page informed consent to do a focus groups, that you can just do a narrative consent. They're like, where's the signatures? Like, you don't need signature. So why you giving money for the communities? Like, that's not giving money, that's paying them for service. And I need that amount. So if you let me hire a research assistant that's gonna cost you $40,000 per year, why I cannot spend that $40,000 with my community partners and divide by them, and they help me to recruit, to retain those communities. So it's that everyday fight to say like how we can use our resources, financial resources, our knowledge, and our time as faculty that's paid by our education, everything that we are right now, direct or indirect, was paid by those communities as well. So
the example why I say it's important to have minority researchers, nothing against the others, but she understands the culture, she understands the people, she understands the needs. And as a matter of fact, she's going to be, and so is this young lady who should be higher up by now. That's the truth. That they're great examples for other young people coming along to get into the research world. Young men, Michael, others, young women to get in, and people of color to get into the research field. Very valid. You know, not everyone's going to be the doctor, the attorney. You know, when I grew up, my mother said, you're going to be a nice colored school teacher or a nice colored nurse. That exactly her words. But I saw something else, and your experiences will take you other places. You know, and of course I'm going to brag on my daughter who's now getting her PhD in music and performing arts. And everything she does is based upon, we have our conversations. I say, you know what, we should have more music performing arts. We should have more kids who are in ballet like you were. And she's, did you get the opinion of the people, Mom? Now, look, I didn't ask you that question, you know, but she's very serious. Every piece of her work. But it started from someplace, started with perhaps with people like Carolyn, you know, asking those very hard questions. Did you get the opinion of the people? If nothing else, I'm proud of her for asking me that question, you know, because she was right. I assumed that all you little Black girls would want to have access to music and performing arts and ballet lessons, right? Because it's, you know, I could justify it. But she said, did you ask the opinion of the people? I'm going to leave it at that.
I just want to say one thing, speaking to the concept of research in general, is that let us, along with what the sister said here about compensation and support, and backed up by Fabiana, let us not forget the intangible desires of the people's hearts. Let us not forget the intangible desires of the people's heart. The purpose of this research is to solve a problem that is intangible for most people. Most people will put a price tag on their value for their small amount of time. However, it is priceless, the solution that will come out of whatever research was produced. Because if I had a solution to a very specific problem that has been nagging me for years and years and years on end, there's no amount of money that you could get that I would not be willing to pay to solve that problem. And research has that ability to do that. This is why people publish books and papers, etc. That's the value of it. You don't know how often or how long I've desired to have a JSTOR account so that I could afford to look at white papers as a poor Black person in a blighted community who wanted real answers, because I couldn't find them in my community. I couldn't find them among my elders because they only had a limited amount of access to information, because somebody somewhere was blocking this information and hiding it behind paywalls. And so when I got a library card and they told me, oh, you can go and get on these websites and you can look at white papers, that made the world for me. Not a lot of people think that way, but it made the world for me, because I was able to go look at white papers and say, oh, Annette LaRoe wrote this book about unequal childhoods, and she talked about how middle-class children and poor children are living differently because of the ways parents respond. Oh, I can use that to tell my mom and my cousin, my sister, and my sister's baby daddy to stop saying X, Y, and Z to this child before they go to school and watch it change their whole day. That little bit of information that would have cost me $150 for a simple white paper to get off of this website, I was able to get because the library had somebody that cared enough to say, if you're really looking for the answers, here's where you can go get them. So I say, please don't discount the value of your research and the knowledge you produce out of it. Thank you.
Everybody, yes, give them a round of applause. I felt like I was in church for a minute because I was, yes, amen, praise the Lord. So I appreciate each and every one of you for sharing your perspectives. You all do fantastic work. Your breadth and depth of knowledge never cease to amaze me. And I'm just so grateful that each of you at some point I have been able to partner with, work with, speak with on a deeper level. And I'm pretty sure I'll be continuing to do that work after this panel.